Hey guys, this is Dr. Hub. Let's look at the case control study. So the case control study is a progression. So it is nothing but a progression from the effect. So it goes from the effect to the cause. So the effect is nothing but the disease and the cause is nothing but that of the exposure. So as the outcome or the disease has already occurred. This is as the outcome or disease. They have already occurred. So it is also called the retroprospective study. It is known as aka the retrospective study. So let's look at how does the design of a case control study look like. So to begin with, it's backward. So let's look at population. There's a population. Then the population will go to the people with disease, and there is also the people that is without the disease. And there is the benign inquiry here and look backwards. There is to begin the inquiry here and to look backwards So there is people with the diseases, and then this moves on to the exposed and also the not exposed. So it is B. Here also the people without the disease, it is again going to the exposed, that is C, as well as the non-exposed, that is D. So this is a rough design of the case control study. Now let's look in detail. We now look at the steps of the case control study. So steps in case of the case control study. So what are the steps? The steps it involves, first is the selection of cases and controls. So there is selection of the cases and the controls. Then comes the matching. So you select the cases and the controls, then you match. Matching is present. Then you measure. So you measure the exposure, measurement of the exposure, as well as there is analysis in the form of exposure rate. There is analysis, and this is in form of the exposure rates. Then there is also the risk ratio. Then comes also the odds ratio. So all the analysis is done. Then we look at the advantage of the case control study. So what are the advantages for the case control study? So it is easy to carry out. It is easy to carry out, and it is rapid, as well as it is inexpensive. So expensive is not much. It requires a few subjects, as well as there is no risk to that of the subjects. It is used to investigate the rare diseases and the differential etiological and the different etiological factors. They can be studied. And the risk factor, it may be identified. Next is there is no attrition problems. There is no attrition problems, and there is a minimal ethical problems. There is minimal ethical problems. So now we saw the advantages. So wherever there is advantage, there must be disadvantage as well. So let's look at the disadvantages. So under disadvantages of case control study, it relies on memory. So it relies on the memory and or the past records. So it relies on the memory or the past records. It gives rise to bias. It gives rise to the bias. Next would be the selection. The selection of the appropriate control groups. So you select the appropriate control groups in difference is difficult. So selection of appropriate control group will be a difficult task. Then comes the incidence. The incidence, it cannot be measured and it does not distinguish. So it does not distinguish. This is between the cases, causes as well as an associated factors. It is not suited. It is not suited for the evaluation of a therapy as well as the prophylaxis. The last one would be there is a representativeness. There is representativeness of cases, and also the control is often, it is inadequate. So this was all about the case control studies. We saw what is the definition, we saw the basic design, the steps, advantage as well as the disadvantages. To learn and grow daily like this, please do subscribe.